Okay, sorry about the technical difficulties in our last video. I know we didn't make it too far in, but we left off at our cranial bones. So, as I said at the start of part two, you do not need to know every single bone of the body. So, your cranial bones, you do not need to know, but we're going to walk through them together, partly because our cranial bones line up with our different lobes of the brain. So, this is a good introduction to our nervous system chapter that's coming up here soon. So the frontal bone is going to be our anterior portion. That's your forehead is going to be the frontal bone. Behind or posterior to the frontal bones, you're going to have your parietal bones. So you're going to have a right and a left parietal bone. So this is going to be kind of the sides, but also the roof of our skull. We have our temporal bones I'm going to jump down to because they are the other sides. They're going to be inferior to our parietal bones. And then our occipital bones are going to be the posterior, and it's also going to help form the floor of our cranium or skull. Do a few other cranial bones are your sphenoid bone and your ethmoid bone. Again, these are not ones that I need you to memorize by any means. Your maxilla is a really good one to know because it forms our upper jaw. It's part of our hard palate. So if you push your tongue up, that's got your hard palate into the top of the roof of your mouth. It helps form our nasal cavities. And one other important part about the maxilla is that it is part of the bone that holds our upper teeth. So our maxilla has our teeth set into it. Our palatine bones are kind of hidden from the surface, but they form the posterior part of our hard palate and help form our nasal cavities as well. Your zygomatic bones are known as your cheekbones, more or less formally. These also help to form our floor and walls on the lateral side of our eye sockets. Lacrimal stands for tears. So your lacrimal bones are going to be on the medial surface of your eye orbit. So zygomatic is going to form lateral, lacrimal will form medial. Your nasal bones will form the bridge of the nose. In terms of our other facial bones, your vomer is more or less dead center of your nasal cavity. So this is what actually forms your nasal septum in combination with your ethmoid bone. Inferior nasal conchae, this is a very small area that's attached to our lateral walls in our nasal cavity. And then other important one to know is your mandible. So this is our lower jawbone, and this, in terms of what you should know this is the only movable skull bone. So if you put your fingers just slightly anterior and inferior to your ears, you can feel where your TMJ or your temporomandibular joint is. If you open and close your mouth, you'll feel that move under your fingers. So that's the only facial or jawbone that has the ability to move quite that freely. Your mandible is your other one besides your maxilla that is going to have teeth set into it. So in terms of the facial and cranial bones, not much you need to know for test material. You should know your maxilla and mandible are your two bones that are going to have your teeth, and your mandible is the only movable skull bone. So this just shows a diagram here. You see your frontal bone, we said that was our forehead. Our two parietal bones, our right and left, form the roof and upper sides. Our temporal bones are below the parietals. Then we have our occipital in the back that's forming that posterior part, and a little bit of that floor. You see the blue underneath. You can also see the sutures here. So you'll notice that our coronal suture and our sagittal suture more or less line up with the coronal and sagittal planes. So that coronal suture is going to separate frontal and parietal, and our sagittal suture is going to be right down the middle. So it's going to separate our right and left parietal bones. You'll see here we have our foramen magnum. So that is where our brainstem is able to exit the skull, and it transitions to the spinal cord. So remember from our skeletal terminology above that a foramen is a hole or opening. Okay, I just mentioned as we were going over some of those bones that they form our nasal sinuses or different sinuses in the skull. And so these sinuses are important because they, one, lighten the skull. Two, they help with sound resonation. They kind of give an echo effect to sound. That's partly why your voice sounds different when you're just talking versus when you're listening to your voice. And they also help warm and moisten the air that's coming into our body from our external environment. So these are our paranasal sinuses. You do not need to memorize these. And this just shows you that we have these spaces or sinuses in the skull. And so on an x-ray, they don't light up as much as our bone because it's just empty space there. So you can see that as well. Okay, our hyoid bone, it's not overly special. Part of the reason that we highlight this is that it's pretty much our only part of the skull that has no direct bony attachment to any other bones. So it's the only bone in our body that does not articulate, or there's no joint with another bone, but it does provide an attachment point for some different tongue muscles and even some neck muscles. So this is your hyoid bone. It's shaped like a U. It sits right on your throat, kind of near your Adam's apple. And the only other kind of fun fact about the hyoid bone is this is something that they look at in autopsies to determine if someone may have been strangled. So oftentimes you see a fracture of the hyoid bone with strangulation. Okay, our vertebral column. So this part you do need to know a bit. So we'll talk about a few different things with the vertebral column. So it is 26 bones in total. The main ones that I'm going to have you know some numbers for are cervical, thoracic, and lumbar region. We'll get to that here shortly. So the first thing we're going to talk about is our different curves in the vertebral column. So here we say anterior and posterior. The other words that you'll see are lordosis, which means sway back. That's going to be an anterior curve. And then we have kyphosis, which means rounded. That's going to be a posterior curve. So the first region is our cervical region. That is our neck. So it curves anteriorly. So our curve points anteriorly in the cervical region. It is considered a lordotic curve, or it has lordosis. The thoracic region curves posteriorly, so it's considered kyphotic. The lumbar region curves anteriorly, so it's considered lordotic. And then our sacrum and our coccyx, those regions curve together posteriorly. And so that would also be considered kyphotic. So you see the pattern here is that it kind of alternates between lordosis and kyphosis. The other thing that I would like you to know about the vertebral column is the number of segments. So we have 7 cervical vertebrae, so 7 vertebrae in our neck. Our vertebrae are each individual bone or segment. So 7 cervical vertebrae. You have 12 thoracic vertebrae, or 12 segments in your mid-back. And then you have 5 lumbar or lower back vertebrae. You then have 1 sacrum, which is about 4 or 5 segments fused together. And then you have 1 coccyx, which is your tailbone. So one way to remember this is that 7 cervical plus 5 lumbar equal 12 thoracic. Or another one that I've heard commonly is that you have breakfast at 7, lunch at 12, and dinner at 5. So you should know this many, how many vertebrae are in each segment. And I want you to know the different curves that we talked about in this slide for the test as well. A couple of cervical vertebrae that we're going to highlight are our atlas and axis. So your atlas is your first cervical vertebrae. It's your C1, and it holds your head. So if you've ever seen the picture of the Greek or Roman god holding the earth, his name is Atlas. So think it's holding up our skull. And then we have our axis, which is our C2, or our second cervical vertebrae. And this is what's responsible for a lot of rotation. About 70% of our total neck rotation comes from our axis. So you can remember the order here because they're in alphabetical order. So T comes before X, so our atlas is above our axis. Some important functions of our vertebral column is that it's going to support our body weight. It provides protection for the spinal cord. So our vertebrae have a central foramen that allows the spinal cord to pass through where it has bony protection both anteriorly and posteriorly. It also has foramen or openings to the side so that our spinal cord and spinal nerves can branch out and exit to travel elsewhere in our body. There's a lot of muscle attachments on vertebrae, and it also allows for some movement of the head and trunk. So we can bend our neck back and forth. We can turn it side to side. We can move our low back and mid back to the right and left, front and back. We can rotate. So all that occurs in the vertebral column. So here's a picture of our total vertebral column. So you see that lordotic curve in the cervical region, the kyphotic curve in the thoracic region, the lordotic curve in the lumbar region, and then our sacrum and coccyx have a kyphotic curve. And so each individual segment here in our cervical, thoracic, and lumbar vertebrae is what is a vertebrae. And you'll see each vertebrae or each segment is separated by a fibrocartilage disc. So there's a disc in between each vertebrae that gives some support, but also allows some movement and flexibility. Okay, our thoracic cage. So it's super important because it gives a lot of protection to our vital organs. So there's a reason that our lungs and our heart are hidden behind our thoracic cage because it provides a lot of protection. So we have 12 pairs of ribs, so 24 total ribs between the right and left side. We have our sternum, which is our breastbone right down the center. And so we break our ribs into a couple of different categories. So we have 7 true ribs. They attach directly to our sternum via the costal cartilage. We have 5 false ribs. So these attach indirectly to our sternum. And within those false ribs, we have a few that are floating. And so they have no attachment to our sternum at all. So this is our thoracic cage. So you see 1 through 7 run directly back to the sternum via this costal cartilage or rib cartilage here. 8, 9, and 10 come back up and meet number 7 before they run in. So they're part of the false ribs. And then you see 11 and 12 don't even have cartilage that begins to run up. You can actually feel those on kind of the sides of your low back. And so those are our floating ribs because they have no cartilage attachments. So you'll notice we have 12 pairs of ribs and we have 12 thoracic vertebrae. So each pair of ribs runs and attaches posteriorly at the thoracic vertebrae and then anteriorly at the sternum, save for our exception of our false and floating ribs. Okay, so we're going to go through our pectoral girdle and upper limb. So some of these bones that we highlight on here, you should be able to pick out on a test. I don't want you to memorize every single bone in the body, but you should at least have a general idea of where they are. So remember, a girdle is going to be an area where we have a limb attachment. So for our upper limb, it's going to attach to our pectoral girdle, which is really composed of our clavicle and our scapula, or our shoulder blade and collarbone. So from there, we're going to have our upper limb attached. So our upper arm bone, our largest arm bone, is going to be the humerus. Our forearm is made up of the radius on our thumb side and the ulna on our pinky side. So that allows our palm to turn up and down as the radius and ulna can twist over top of each other. Your wrist bones are known as your carpal bones. When you move up a little higher into the start of our hand, we have our metacarpals, and then our fingers themselves are known as the phalanges. You do not need to know all these landmarks by any means. This is just a more zoomed in view of our scapula and clavicle. So this is the anterior view and posterior view. And then here's our clavicle. This is where it would meet your sternum. And this is where it would be meeting the shoulder blade and shoulder joint. So we just talked about those. So again, this is a zoomed in view of your humerus. You do not need to memorize any of these landmarks here. Just one thing I'm going to point out is just like our neck and our head as the entire body, for a couple of our bones here, like the humerus and the femur, you have a neck and a head to the bone as well. I'm going to skip past this stuff. Okay, our pelvic girdle. So this is where our lower limbs are going to attach to the body. So you have your pelvis, you have your ischium, your ilium, and your acetabulum. All of these make up the pelvis. So your ilium is this upper portion of our pelvis. So our pelvis is composed of 3 bones. Our sacrum is part of our axial skeleton. The pelvis itself is appendicular. So your ilium is this upper portion. Your ischium forms these bones down here, our sit bones in the back, and then this anterior portion is our pubis. So that's the pelvis. The acetabulum is the socket for our hip joint. That's where the head of the femur is going to rest in to form the hip joint. So this is just a male versus a female pelvis. So the male pelvis is a bit more narrow. Female pelvis is a bit wider. That's due to the need for females to have the ability for childbirth. And then moving further into the lower leg, we go from here. So your biggest bone in your body is going to be your femur. Your patella is the name of the bone that forms your kneecap. Your primary shin bone is going to be your tibia. You also have a much thinner bone on the lateral portion of that lower leg known as your fibula. Your tarsal bones are going to be your ankle group. So that includes the talus, which is directly under your tibia. And that also includes your heel bone, which is the calcaneus. If you move farther down the foot, just like the hand, we have our metatarsals. So the wrist is carpals and then hand metacarpals. The ankle is tarsals and then metatarsals. And then for both the fingers and the toes, we have our phalanges. Again, some zoomed in views on specific bones for those of you that are interested in looking at these just a little bit more. One example to point out here, here's the tibial tuberosity. That's that lump of bone. So our patellar tendon attaches there. And since there's a lot of force pulling through that area, it builds up that lump of bone known as a tuberosity. So here's our talus that's directly underneath our tibia. And then as I pointed out, our calcaneus is here. So your Achilles tendon attaches to the posterior portion of your calcaneus. You have a couple other tarsal bones here, like your navicular, which forms your arch. Your cuneiforms form this upper or kind of proximal portion of the foot prior to the metatarsals. This is just showing how that arch is supported by some of these bones. Oops, sorry, guys. Okay, so articulations or joints are synonymous with one another. And so these are going to be where 2 bones come together. There's a few different ways that we classify articulations. So one way is by the material that forms them. So fibrous versus cartilaginous versus synovial. And then we'll also classify them in their functional categories. So synarthroses, amphiarthroses, and diarthroses are 3 different categories that go hand in hand with fibrous for synarthroses, cartilaginous for amphiarthroses, and synovial for diarthroses. So as we said, our structural classifications are going to be based off of the type of tissue. So our fibrous joints are going to be united by fibrous connective tissues. Our cartilaginous joints are going to be united via cartilage. And then our synovial joints are going to be joined by a synovial membrane and synovial cavity. So our synarthroses, syn means together, so this is going to be a non-movable joint. So those sutures in our skull that we were looking at earlier are a great example of a synarthroses. They are not going to move around. Our next one is our amphiarthroses. So this is going to be our cartilaginous joints, and these are going to be slightly movable. So our fibrocartilaginous discs, our intervertebral discs are going to be a good example of this. And then something like our pubic symphysis would also be a good example. And then finally, our diarthroses. These are our freely movable joints. These make up the large majority of joints in the body. These are our synovial joints. So our knee, our elbow, our hip, our shoulder, all of these are diarthroses, our freely movable joints. So as we said earlier, our synovial joints are going to be surrounded by a joint cavity. And so this is created by a joint capsule. So this helps hold our bones together for congruency, but still allow for movement. And it's going to consist of an outer fibrous capsule, and then the synovial membrane forms the inner lining of our synovial joint. So this shows here, we have this fibrous capsule, and that's going to end up being kind of synonymous, or sorry, not synonymous, but run consistently directly into the periosteum. We have our tendon and tendon sheath that's also going to run directly into that periosteum. You see we have our inner layer that's going to be the synovial membrane. And so within this inner layer and outer layer between these two, this cavity is going to be filled with synovial fluid. So that's kind of like the oil or lubricant for our joints to prevent friction and allow them to move much easier. So our types of movement, I would recommend going to YouTube and taking a look at kind of a video going through these different movements and going through it with them together, because it's a lot easier to visualize than listen to. So flexion is going to mean bending. So I'll use my elbow as an example. If I bend my elbow to bring my hands towards my shoulder, that's going to be flexion. Or for my knee, if I bring my heel to my butt, that's flexion. If I'm doing a march, that's flexion of my hip. If I raise my hand straight up in front of me, that's going to be flexion of the shoulder. And so the opposite, or the partner for flexion, is going to be extension. So that's going to mean straightening. So if I straighten my arms out all the way, that's elbow extension. If I reach behind me, that's shoulder extension. If I put my leg all the way straight, that's knee extension. If I keep my leg straight and bring my leg behind my body, that's going to be hip extension. Abduction or abduction and adduction or adduction is going to be our next pair. So you really have to pay attention to these two because they sound so similar. So abduction or abduction is going to mean to move away from the midline. So if I raise my arm like a jumping jack, that would be abduction of the arm. Or if I spread my legs apart in a jumping jack, that would be abduction of my legs. Vice versa, when I bring my arms back down, or when I bring my legs together, that's going to be adduction or adduction because I'm moving them back towards the midline. Pronation and supination are going to be unique to our forearms. So pronation is putting the palms down. Supination is putting the palms up. So the example I always use is, please, can I have some soup? If your palms are up and open, you can have some soup. If your palms are down, you cannot have any soup. So supination is palms up. And then we have rotation. So this comes in kind of a couple different forms. So in terms of the neck and the low back, if I just turn my head side to side, that would be considered left and right rotation. Or if I twist my trunk back and forth, that would be thoracic and lumbar rotation to the left or the right. You can also have medial and lateral rotation, which are called internal and external rotation as well. So the best way I can describe this is with your feet. If you turn your toes in towards each other, that would be internal or medial rotation of your hips. If you turn your toes out and your heels are pointing together, that would be external rotation or lateral rotation of the hip. One other example, if you put your elbows at 90 degrees and tuck your elbows right by your sides, if you rotate your arms kind of palms away from each other, that's external or lateral rotation. If you go back towards your belly, that's internal or medial rotation. So this is just a few examples here. One other one that was not covered on the slide above is circumduction. So think circle. So circumduction is making a circle with the arms. And then a couple that I just wanted to touch on that are unique to the ankle. If I make a gas pedal motion, that's called plantar flexion. If I pull my ankle and toes towards me, that's dorsiflexion. If I go towards the midline or towards the inner portion of my ankle, that's inversion. If I go away from the midline or laterally, that's going to be called eversion. So those four are all unique to the ankle joint. So that's the last bit of lecture for our skeletal system. And make sure to take a look at the study outline to help you narrow down what to focus on. But definitely focus on the stuff from about slide 1 through slide 40 or so. And then in this part, pay attention to what I highlighted and what I mentioned for not paying attention to.